Hey everyone, Dr. Josh Binstock here at Aethos Performance Culture. Today I'll be going over shoulder exercises to help alleviate any pain you may be experiencing in your shoulders, particularly overhead athletes such as volleyball or baseball players. These exercises will not only help heal the pain and relieve any symptoms, but prevent the pain from coming back and increase the power and velocity you'll be able to generate through your shoulder to help increase the speed of your throw or spike. This exercise is called side lying abduction. So you would use the floor. I have the table here, but this simulates the floor. It's very easy to get. Get any weight that you feel comfortable with. Start with no weight first to make sure you have the proper technique, and then you would build up to either a 2-pound, 5-pound, or 10-pound. So you go on your side with the shoulder you're working up. You want to be comfortable, so you can make sure that you have a pillow here or your arm. The front leg straight, the back leg bent. Now, what I'm going to do is lift it up to the height of my knee, but very important, you have to set your scapula. So you bring your shoulder blade back and down first. Then I'm using my scapula to bring the weight up and slowly bring it down. Very simple, but you want to focus on coming up to the top of your knee and then slowly bringing it down. You know you're doing it properly if you feel the tension right behind the shoulder blade.
This exercise is called the push-up plus. So it's very important with this exercise that you do not bend your elbows, which is really difficult because a lot of people are used to hearing push-ups and bending their elbows. With this one, the elbows are staying straight and the arms are staying straight. So the way I can make sure my arms stay straight, you get in a tall plank position and I screw my arms so the elbow crease is facing forward. Now, once I'm forward, I slowly lower my chest down. So you see that I'm not sagging here and I'm not up. It's a straight plank. And the only movement is going through my shoulder blades. So I'm thinking about bringing my shoulder blades together and then pushing up as far as I can away. Slowly lowering down, bringing my shoulder blades together, and then holding a plank, pushing up as far as I can. Now, once that gets easier, then you can bring in something like a BOSU ball or something that's a little dynamic and unstable. You can put a pillow there, you can put a bunch of blankets there. So it's just creating more instability. And the movement's the same. Bringing the shoulder blades together, pushing up as far as you can. And once that even gets easier, then you can take your dominant arm and do it one hand. Same thing, you don't want the shoulder to be dipping. You want to be straight, shoulder straight the whole time, arm straight, pushing up. Shoulder blade coming together, and push up.
This exercise is called concentric eccentric. It's pretty much just fancy words for muscle shortening and lengthening. So the concentric part is going to be the external rotation. So what you're going to do is go on the floor, go on your side. You want to be comfortable. You can have a pillow or rest on your arm. Now I'd suggest putting a towel or some kind of blanket on your hip because you're going to be putting your elbow on your hip and keeping it there and driving it down. So you want something that's comfortable. Grab a weight of your desired amount. Making sure it's difficult but not painful. So again, before we do any exercise, you want to set your scapula, bring your shoulder blade back and down. If my shoulder blade is not back and down, I'll be able to hit the ground, which you don't want. If it's back and down, it brings it up a bit. So from here, the concentric part is bringing your arm up as far as you can, straight into the air, turning over and slowly lowering at a 45-degree angle. And the slow part is the key. And then you come back and that's one rep. So again, you want to use the back of your shoulder blade to bring it up, push up as high as you can, turn it over, and slowly lower down at a 45-degree angle. You should feel a burn in between your shoulder blade. This exercise is called the dynamic back burn or modified swimmers. Very important exercise, but it's important that you do it slowly to make sure that you get the most out of it. So you're going to go on your stomach. Now I have a towel here. Get something clean because I want you resting your head on this towel. I don't want you thinking about keeping your head up and creating tension in your neck. So my forehead's resting very gently. Before any exercise, you're going to start with your scapula and shoulder blades back and down, called setting your scap. I'm going to have my arms up, my elbows straight, arms are straight the whole time, coming around, and as you see, my thumbs are approaching the horizontal line. I bring them up forward. I have weights here to make sure that I clear them, but keep it as high as you can. Then at the top here, I rest. Then as hard as I can, push down into the floor, 5 seconds. And then I come back up,
Keeping my traps off, I'm not shrugging. Shoulder blades back together as high as you can. Bringing your thumb down, and that's 1 rep. So it's important to make sure elbows straight, shoulder blades back together, neck is resting, thumbs are down when my arms are underneath the horizontal plane. Now I'm about to pass the plane, so my thumbs come up after that, keeping them as high as possible. Rest, press into the floor with arms straight, as hard as you can, 5 seconds. Then come back up as high as you can, resisting the urge to shrug your shoulders, keep them back and down. And you know if you've done it properly, if the muscles between your shoulder blades are burning.
This exercise is called the field goal. It's pretty self-explanatory. The reason it's called that is because that's the sign and the shape you're making with your arms. So I have a table here, but if you're at home, you can use anything that you can lie on, a bed, a couch. You're gonna go lay on it with your stomach and have your arms hang down in front. Now, if your arms are touching the bottom, that's okay. Let's say you're touching when you're here. That's also fine. The whole point of that is to make sure that you're using your scapular stabilizers, your shoulder blade muscles. So what you're gonna do is bring your arms up to the side using your shoulder blades and then rotate up in the air with the thumbs up. Slowly back down, head neutral, and slowly lower. So the key is before I do any movements, I'm setting my scap, retracting my shoulder blades, then I bring my arms up to 90-degree angle, thumb up, and rotate on that axis. Now, a lot of athletes, when they get fatigued, when they start bringing their shoulder up, especially with weight, their shoulder and their elbow starts to migrate down. So that's compensating, and that's kind of cheating the exercise, and that also will cause a shrugging of the shoulders. So you don't want to do that because that will cause tension in the front and you're not doing it properly. You want to make sure that when you do have weights, this is 3 pound, I would say start with 1, progress to 2. Bringing your shoulders up, setting your scap, 90 degrees, thumbs up, keep that elbow rotating on that axis where it is in space. If anything, bring it forward and then slowly lowering it down for 1 repetition. Up to 90, thumbs up in the air, keep your elbow where it is. You can come forward a bit, slow, down. You know you're doing it right if you feel a burn in between your shoulder blades. This exercise is called bilateral back burn. So what you're gonna do is get a table, a couch, a bed, something that you can lay on your stomach, elevated. Arms are gonna be hanging, and what you wanna make sure you're doing, again, like every exercise, is setting your scap, bringing your shoulder blades back and down, and bringing your arms up to a horizontal. You don't want to raise up as high as you can, just to horizontal and slowly lower. Now, if you want to get weights and make it more difficult, same thing, thumbs come up, shoulder blades back and down, and think about using the muscles between your shoulder blades to raise your arms, not the actual shoulder joint itself. And slowly lower down. Again, you know if you're doing this properly, if you feel a burn or tightness in the muscles between your shoulder blades. This exercise is called the empty can or modified empty can. The reason it's called that is you're visualizing emptying a can. So what you're gonna do is start feet shoulder width apart, little slight bend in the knee, and you're gonna have your thumbs down, pretending you're emptying a can. Before we move, shoulder blades back and down, setting your scap, and coming at the 45-degree angle. So you're not coming out to the side, you're not coming out forward. It's a 45-degree angle because that's the angle the scapula sits on your thorax. So you bring it up slowly. Before I get to the horizontal plane, I turn my thumbs up, then I pass the horizontal 90 degrees, come up as high as I can, slowly come down. Now, if you want to make that more difficult, you can use a weight. Again, start with 2, then go 5, then 10. Same thing, turning your thumb over, bringing it up. Now, very important, my traps, I'm not shrugging my shoulder as I come up. That's key. You want to make sure your shoulders stay down and back, and as you come up, turn your hand up, and the shoulder staying down as I'm raising my arm. I do not want to see my shoulder raising up as I'm helping it. Shoulder down, raise up as high as you can, slowly lower, contracting your abs the whole time. This exercise is called the standing 3-way, pretty self-explanatory. You are standing and you're going in 3 different planes. So grab a weight that's appropriate for you. The 3 planes, you're going to be forward flexion, thumb up the whole time, up to 90 degrees, slowly down. Scaption, 45 degrees, thumb up, slowly down, and abduction 90 degrees out, horizontally and down. Again, very important, as you're coming up, you don't want to feel like you're shrugging your shoulders. Shoulders stay down, and you come up, down, slowly, thumb up the whole time, arm straight the whole time, 45 degrees out, slowly, and out to the side, to horizontal, slowly coming down. This is the external rotation exercise. So there's two ways to do this. Many of you have probably seen when your arm's down to the side, which is good. You should be starting off with that. I would have a pillow, blanket, towel, something to tuck between your elbow and your hip to make sure it doesn't come off. You want your elbow in here the whole time. Now, if you have a band, you could use the band, tie it up, and do this there if you have at your home. We're going to be using the Kaiser machine. Same principle, same movements. So again, you want to move away to get the tension coming from the outside. Shoulder blades back and down. Elbow tucked in, wrist straight, and bring it out as far as you can. I don't want to be twisting. I don't want to be hiking. The only movement that's happening is at my shoulder blade and the shoulder joint behind me. Slowly out as far as you can, slowly in. Scapula back and down, not hiking. Now, specifically for the overhead athletes, volleyball players, baseball pitchers, again, you could use your band, tie it around anything up top, and you're mimicking a baseball throw or a volleyball spike. Again, I'll be using the Kaiser machine, but nothing changes. So, for righties, you're going to have your left leg forward because when you're pitching, your left's forward, and when you're approaching, your left's forward. So you're going to go on your right knee, left foot forward. Mimic the movement you're going to be doing. Bring your arm up, and you're going to come forward. Now that's internal rotation. For overhead athletes like volleyball players or baseball players, you want to make it similar to the actual game move you'll be doing. So again, you can grab your band and tie it to anywhere that it'll fit on, and you'll be able to raise it up high. Now again, I'm going to be using the Kaiser and show you what to do. So you'll be doing external rotation as well, but you'll be doing it at a throwing or hitting motion. So again, your left foot's going to be forward, because when you throw or spike, your left foot's always forward for righties, opposite for lefties. So you're going to have your left foot forward and put your arm up high this time, elbow still at 90-90, and rotate back. I don't want the shoulder to hike up, and you also don't want your elbow moving. Your elbow stays exactly where it is in space. You're rotating on that axis, so the only movement that's happening is through the shoulder blade and shoulder joint. Very slow down and as far as you can back. You can raise it up as high as you're comfortable with. This is the internal rotation exercise, so this is responsible for the acceleration of the throw or the spike. Again, with your band, you can bring it up there, and I want you to make sure that you're mimicking the exact movement you'll be doing during the game. So you can bring it up here and come forward. Left foot forward for righties, opposite for lefties. You want your arm 90-90, coming straight forward, slowly, keeping your elbow where it is in space. Elbow doesn't move, shoulder doesn't shrug, shoulder down, elbow still, coming forward. Now you can modify that to make it specific for your actual movement in the game. So if you're throwing a baseball, you can actually increase the velocity and come across. Slowly come back, come across with hip rotation. Volleyball players as well, if you're coming across your body or if you're hitting away from your body, you can modify it for your sport specific. Keeping your abs engaged and chest down, ribs down. This exercise is the elbow flexion, supination, and pronation. Pretty much is describing the exercise. Elbow flexion is when you're bending your arm. Supination is bringing your hand towards you. Pronation is bringing your hands away. So you're going to have your left foot forward again, down on the right for righties. And get your band high. Make sure it's coming from a high spot. Wrap it around to get your desired tension. And you're doing a bicep curl up high. And it's for the biceps tendon that goes into the labrum. Very important for overhead athletes. So the key is here, you're doing a bicep curl as I'm supinating. So I'm bringing my wrist into me as I'm bicep curling. The key is here, the elbow stays where it is in space. If anything, it stays high. As athletes get fatigued, we have a tendency to lower the bicep because it's easier to bring it in. But fight that urge, really keep that elbow high and come forward. Very slow and forward. Now also, not only are you bringing it in, but you also want to bring it out at the same time. So supinating and pronating, my elbow staying high the whole time slowly. And you know you're doing it properly when you feel it in the ribs here. That's your serratus anterior.